Hello, my name is Alyssa Thompson, and today I will be discussing the opioid epidemic and specific legislation such as the AB 474. The opioid epidemic has been something that's been affecting the people of the United States since 1991, and this was due to the increased rate at which physicians were prescribing pain medications such as oxycodone, hydrocodone, morphine, fentanyl, benzodiazepine, Percocet, tramadol, and Ritalin. Initially, physicians did not know the long-term effects of these medications and were unsuspecting of the possibility of addiction. It was easy to get these prescriptions from your doctors, and due to this fueled the opioid epidemic in the United States. Now, what is AB 474? AB 474 is a bill that has been put into place in an attempt to address the opioid epidemic that the United States is currently facing. It's also known as the Controlled Substance Abuse Prevention Act, and it's creating a clear standard of care when it comes to the prescription of pain medication. It was put into place locally here in the state of Nevada, and it went into effect on January 1st of 2018. By creating a clear standard of care, this eliminates any questions or confusion regarding opioid prescriptions by physicians. Now, who does this affect? This affects both healthcare providers and patients. For healthcare providers, it increases the amount of paperwork that they have to do and to ensure the proper use of prescriptions. It also requires healthcare providers to report any suspected overdose or any overdose that occurs, even if it may not be opioid related. That way it can be properly investigated. Now, as for patients, it puts into place regulations that cannot be bypassed, and this makes it harder for patients to get access to pain medications, especially if they are first-time patients. Patients must have a genuine relationship with their physician before they're able to get a prescription for pain medication. Healthcare providers are also at a higher risk of losing their license if they are not following each requirement. Advantages to AB 474 is that there is increased regulation, mandatory physical patient assessments, addiction prevention, reducing inappropriate prescriptions which were written by physicians and they weren't justified, increased patient-physician relationships. Now, some disadvantages of AB 474 is that it is time constraining on the patients and the physicians. There may be a decreased time that's actually spent in the room with the patient, increased paperwork, increased patient monitoring, and that is to ensure the proper use of prescriptions. Now, some disadvantages. Thank you for taking your time to listening to my presentation. Thank you for taking your time to listening to my presentation about the opioid